Transform your life by taking proactive control of your health and future with toxin therapy.
MD Lifespan is on a mission to create a society that depends on proactive care and less on pharmaceuticals, and is dedicated to putting clients first by listening, staying accountable, and building relationships. Dr. Paul Savage joins us with more. Welcome, doctor.
Thank you for having me. Appreciate that.
We appreciate you being here. So tell us a little bit about your background.
Well, I was graduated from University of Michigan. I was in the largest trauma center in the world for about 10 years. And at the end of 10 years, I'm 275 pounds. I have established heart disease, diabetes, hypertension, a whole list of medicines. And I'm 38 at the time. I go see my doctor and say, I don't feel well. And he said, go exercise and eat better. And I did. Nothing changed. And I suddenly realized if I wanted to live my full life, I needed to take my health and wellness seriously. So that started me on a journey to what people can do to optimize their health and wellness. Because as an ER doctor who saw people die from everything for 10 years, the best way to avoid dying is to live healthy. And I know that sounds like an oxymoron, but people don't understand it's an active process.
So when we talk about living healthy, which is what helped you get fit and become healthier yourself, I know a big part of that is you're saying there's toxins all over that impact your health. And we talked about at the beginning, toxin therapy. What is that and what does that mean?
Well, one of the things that people need to realize is as of 1960, when we first started putting toxins in the universe, it didn't exist before that. That's when the pesticides and herbicides started happening, and then the heavy metals, and then all the fumes with all the coal-burning power plants. And anyway, we've saturated our environment now with toxins, whether they're heavy metal, pesticides, herbicide, or the new one that they've talked to it, microplastics. The fact is, they're at incredibly high rates in everybody and in all of us presently, which is why we're seeing an increased rate of cancer in younger people, neurodegenerative disease in younger people. We're seeing children born with microplastics in their first stool. And the persons that are impacted the worst by these toxins are the young, and even those in utero, because that's where the body's developing and the most susceptible to these toxins.
When we do read articles or hear reports, it sounds like you said, it's everywhere. It's impossible to avoid. So what can we do?
Well, it's not impossible to avoid. That's the good news. We always talk to our patients about air, water, food, and shelter. The air of your house, believe it or not, most of the toxins that we're exposed to that are very dangerous, we're exposed to inside our house. It's in the fabrics that we use and our softener. It's the carpet cleaners. It's all these things that you have underneath the kitchen sink, in the bathroom, and in the garage. And there's ways you can change those things so they're not harmful to you. So it's filtering the air also, since air pollution and microparticles are what cause a lot of the lung cancers. You can have different type of HEPA filters that screen for those things. You have triple filter reverse osmosis water, and you can get those from $400 modules all the way up to $25,000 for your house, so that you're cleaning your water as well. And then food is obviously the important one. Stop buying processed food. If it doesn't grow on a tree, or you pick it up out of the ground or the water, leave it in the grocery store. I always tell my patients, stay to the outside of the grocery store and only run inside to get the toilet paper, and then run back out real quick again, because the fruits and the vegetables and the milk and the eggs and the meat, those are pretty safe overall. Not completely, but very much safer than the stuff you're getting processed.
So if you follow all these steps, hopefully that helps avoid some of these toxins even getting in your body. How do I know if do I have them in? I'm assuming yes.
The answer is yes.
Yeah.
The answer is we did 300 patients over in 2024 that we measured, who are adults at 50, men and women. And on average, out of 100 toxins that we tested, the average number for people was 12, with 5 of those being in the 95 critical range. So on average, people are walking around with glyphosate, mercury, lead, BPA, all these things we heard about, and all these things are problematic. Now, the good news is, in most of the kinds at that number, just doing the things I talked to you about with the avoidance helps reduce it, because the body can get rid of them if it's not overloaded. However, some patients have crossed that line, and the toxins do everything bad, including inhibit the way that you get rid of them. And once you cross that line, they can build up, and we see people in the 20s and the 30s,
well, Dr.
which is
Savage,
a totally different problem.
I'm sure Sarah and I, as adults, and the way we eat, I watch what we eat for lunch, we've probably crossed that line. So what can we do, and what do you do to help people?
So a group of physicians and scientists, researchers, we got together and we actually came up with a process that involves a technique that's been in medicine for 50 years. It's called plasma exchange. This is a process which we hook you up to a machine and we take your blood out. It's like a plasma donation, but instead of giving your plasma back to you, we give you back human albumin. And within 24 hours, your body makes new, fresh, non-toxic, non-inflamed, non-cancerous plasma all over again. So we do this every four weeks for usually 3 to 5 treatments. And what we've seen is we've seen all the toxins reduced almost completely to zero. We're seeing 70 to 95% reduction in microplastic, pesticides, herbicides. And what we're seeing as patients move out further at 6 months, a year, they keep going down even further. So it's amazing that for the first time ever, we actually have a solution to the problem of toxicities in people, especially those that chronic inflammation is driving their health, the Alzheimer's, the cancer, the heart disease. Removing the toxin almost always turns off all the chronic inflammation. So we know that. We just didn't know a way to get it out, but now we do.
Wow.
Dr. Paul Savage, fascinating. Thank you so much for being here. For more information, head to that link on your screen, mdlifespan.com. You can also find them right there on social media.
Thanks for having me.